Hi everybody, sorry I'm a little late. Today is usually an office day for me, but today with the holiday it is an OR day, so I'm just in between cases here, and I wanted to talk to you about otoplasty or ear surgery. Some of you may or may not have heard of that before, but ear surgery we do to correct deformities of the ear, and these are typically things that people are born with. So what I'm going to focus on today is the most common reason we do otoplasty, and that is for what we call a prominent ear. Some people just think of it as my ears stick out or my ears seem big. So I'm going to show you on me here kind of a little ear anatomy here. So you have the height of the ear. We look at the height of the ear, but when people think their ears are big or that they stick out, it's usually because they're doing something like that. And there's a couple of reasons that that can happen. One is this inner part of the ear, that cartilage, sometimes is really large. And so with this being large, you can sort of see if I kind of make this come out like that, it sort of seems like my ear is sticking out because this cartilage is really large. The other most common reason that people can feel their ears stick out or they're too big is, see this fold of cartilage right here? That's called your antihelical fold, and some people don't have a fold, or the fold is not prominent enough. And so you can see if this wasn't folded back like that, like it's supposed to be, and it's kind of flattened like that, it gives the appearance of my ears stick out. So those are the two most common reasons that people see us as plastic surgeons for ear surgery. And they come in saying my ears stick out, or I don't like the way it looks. Let's say I'm wearing a headband or something like that. I don't like the way this looks because it really sticks out. Sometimes even kids will come in for this type of surgery. So typically this is a surgery that we would potentially do on a child, sometimes as young as a fairly young child, 1st or 2nd grade. The ears grow fairly quickly, and then typically you get to a point where they don't grow anymore. And so even though the child is still growing, their head is still growing, et cetera, their ears don't really grow much more. And so this is a safer surgery to do in a younger child, sometimes teens and sometimes adults. Sometimes people come in and they say, this is something that's always bothered me. So how do we fix it? Typically, this is done in the operating room with you asleep or under sedation. We do a couple of things. We reduce the size of the cartilage on the inside. We do this through an incision on the back side of the ear. So that's where the scar is hidden. It's hidden on the back side of the ear, so typically not something that anyone could see later unless they were really looking for it. And then, again, through the back side of the ear, we do maneuvers and sutures to create this fold here. So we reduce the size of this cartilage and we recreate a fold to recreate normal anatomy. And by doing those two things, it gives the ears the appearance of kind of sitting back closer to the size of the side of the head. So it's actually a really, really satisfying surgery. It's one of my favorite things to do because it really makes such a nice difference. And patients who are bothered by the appearance of their ears, it's usually something that's really bothered them for a long time. And so it's really, really fun as a surgeon to get to do something that makes such a difference in their life. As far as recovery, so you have the procedure, you go home the same day. We put dressings on to put a little bit of pressure and a head wrap. You have that on for about a week, and then we put on an elastic wrap, again, to keep a little pressure on that part of the ear for a total of another week. So 2 weeks of kind of a wrap. And then after that, you don't really need to keep it wrapped up, but at least I don't want you doing any activities or sports or contact where you could have something or someone bang into your ear. And so we want you to protect it for about a month after surgery. So you have a little bit of bruising, you have a little bit of swelling, you have a little bit of discomfort, but it's typically not horrible. So usually people can kind of get back to doing their normal daily things in even a few days to a week, depending on how you want to cover up that head wrap. And then after a month, you can get back to all your activities, including exercise, etc. The biggest things we worry about with this particular surgery would be recurrence. So we're recreating this fold in the ear here. There is a chance that your cartilage has some memory and it could fail and it could spring back open. That's more common the older you are. So in children, the cartilage is a lot more malleable or movable. And in older adults, it's a lot less malleable. So in like a teen, early 20s, kind of moderate risk, but older people have a higher risk of that. But for the most part, it is, again, an incredibly satisfying surgery. So this was a quick video today. I hope you learned something. If you are interested in having us evaluate you to see if we can help out with the appearance of your ears, give us a call. We're happy to always see you. And I'm going to get back to the OR. And as you notice, I'm wearing my Wisconsin hat today because they are playing in the Pinstripe Bowl. So tune in ESPN 4:15 p.m. Central Time and root for the Badgers. Okay. Bye, guys. Have a great day.